Hello everyone, and welcome to the 40th episode of CBCLIPS. In this episode, I present you with a little girl who presents with an acutely inflamed neck mass just off the midline. She has no fever or systemic symptoms, and you see the images here. Now, there's a number of differential diagnoses that came through. One was the possibility of a lymphadenopathy. This would be highly unlikely without any fever or systemic symptoms. It's also not the place for mycobacterial adenopathy. Two was that this could be a branchial cleft anomaly. Again, this is not a location for branchial cleft, either one or two. This is really high in the neck and just off the midline. Number three was the possibility of a dermoid cyst. Again, yes, possible for dermoids to present acutely, but in the neck, they're almost always midline. And finally, the correct diagnosis, which many of you made, was a thyroglossal duct cyst. Many of you requested an ultrasound, and an ultrasound, in fact, was done, which you see here. But I have to tell you that many times I do not obtain an ultrasound because often it does not change the plan of care or really give you any additional information. It's still a clinical diagnosis. This case presents us with four important clinical principles regarding thyroglossal duct cysts. Number one, thyroglossal duct cysts can be slightly off the midline. We think of it always as a midline mass, but there can be multiple small tracts and they can present just off the midline. Number two, acute presentations are not usually infections. They're typically inflammation secondary to ruptures or micro-ruptures. So antibiotics do not make a difference, and that's why these patients are afebrile and they have no systemic symptoms. Number three, incision and drainage is not indicated for the same reason that this is not an infection. And number four, you should not operate in the acute phase. Wait until the process cools off. And in this patient, we actually operated about 4 weeks later with a cyst drug procedure, and she did very, very well. Thank you, and until the next CBCLIPS.